Hey, this is Dr. Zach Watkins, and I wanted to address a question that revolves around how does a functional medicine membership model work? And this is mainly for practitioners who are either implementing functional medicine into their practice or they have a functional medicine based practice, because I have seen practitioners who have the model set up, yet there's no, let's say, we call it membership model set up in their practice, which I feel is a disadvantage with a lot of practices. Now, when I say membership model, I don't like the word membership per se because it gives the impression of like a club or a country club or a gym or something. But I think for this video, we'll use the word membership just as just the catchphrase. And my biggest issue with practitioners not having a functional medicine membership model is kind of a couple fold. One, patients. Patients, in my experience, they're going to come back after their programs or their care plans, as we call them. And let's say they're either were like 8 weeks or 12 weeks, which is pretty typical. And they'll come back and they may say, let's say they're getting great results. You're a great practitioner, you're a great clinician, you're doing the right labs, you're doing the right, let's say, products. And I think what you're going to find is patients will start to say, well, what's next? What do I do now? And a lot of practitioners that I've come across and mentored and talked to will basically just say, well, take these pills indefinitely. Let's follow up maybe in 6 months, see how you're doing, or message the clinic if you need anything, or stuff like that. And what you'll find is that's not a bad thing. They get empowered maybe, but they actually might go somewhere else because now they're like, well, he or she did their job. Now I'm going to go find something else over here. Maybe a different influencer, maybe another clinic in town that showed me how to, do things for weight loss or whatever. So I think what patients are looking for specifically are going to be leadership. And if you can set up a model that says, hey, you've done well, now let's continue on that path and plug you into our, let's say, maintenance protocol or maintenance plan. What I typically recommend is setting up a maintenance protocol that, in my opinion, you've had lab work, let's say, because lab work are going to tell patients where to go, what to work on. It'll give you some indications about nutrition, any risk factors that pop up. But let's say they finished their program and they did a follow-up lab and you got some data. Well, this gives you reason to say, I want you to fall into our maintenance or membership plan, which let's say it's 3 months or 6 months or even a year. And what we're going to do is we're going to give you more incentives. We're going to give maybe more discounts on some of the nutritional medicines we use. You're going to get maybe even a higher discount percentage based off of, let's say, on different testing you may need. Maybe we'll do clinic-wide special VIP events. I think make it like an elevated experience. In my experience, patients loved it because they didn't have to go out and find someone else to tell them what to do. Or if some other problem came up, a lot of times they may not come back to you, then you go somewhere else. Oh, there's an expert down here for this. I'm going to go over there. So if you keep them engaged, you're going to really be that expert that they can go to. I found it very common and consistent. Patients would always want to follow up, doing more lab testing, maybe want to continue pricing or continue purchase of their supplementation they may need. So patients became involved, and it was nice to see because they started taking ownership. So you give them lots of incentives, be a part of the programs, a lot of follow-up, because you are being the leader of them, of their health, and maybe the questions that they're going to have when it comes to prevention. And I think that's a win. So patient focus is the big benefit. The second one is going to be you, the clinician. And I say this because we take the clinician hat off and put the business hat on. You're running a business. You got to do things that sustain you. You got to sustain your overhead. You got to make money to help other people. So not only are patients going to get well, but now you are going to set up a system that gives you the consistent revenue you're going to need for a business to grow, and actually makes the business more valuable because you have business on the books that can be evaluated to make the business worth more. So now I'm talking like residual, maybe supplement purchases, or maybe they're doing follow-up lab work. If you have other services, let's say chiropractic or IV therapy, injections, wherever it may be, you can bundle all that together, discounted enough that makes it very incentivizing to them, but at the same time gives you that residual monetary benefit. So now you're giving people a great service, You're not like stealing from them. You're not raising your prices too much, but you're becoming the leader, the authoritative role in your community, and it gives them opportunity to keep them engaged, which I think is a win for everybody. So that's how I tell how the models work. I've seen providers that don't have something set up, and I think that is detrimental to both you and the practitioner and patients, because we all know that as long as we're alive and breathing, we need to do things for our health. And actually, the older we get, the harder it gets. So letting them go off somewhere else or tell them they're fine or check in when they need you, to me, is the wrong way to go. They're always going to need someone. They're always going to need somebody they can talk to and to work with, which is why I think a part of your incentivizations could be anything from like a private doctor clinician line or a bi-weekly Zoom call for your kind of patients. So I think that's how I think a typical model should work, a functional medicine model. This is not like a membership like in some of these boutiques where they just kind of come and get all the stuff you want. I think you can add that in, but let's put parameters around how you're going to check in on your patients. And check-ins like auditory calls, texts, all that kind of stuff can fine. But I'm a big believer in really working in your lab evaluations in your membership follow-up, so that one, it gives you the ideas of where they at. Do we need to course correct? Are some of the nutrition levels doing better than we thought? But also gives them a reason to keep accountable. So that's the benefit as well, is it keeps them on top of things versus falling off the plan for multiple months or even years, and then deciding, oh shoot, I got to get back into this. So you're doing them a service, they're doing you a service. So think about that next time you're trying to think about building out your functional medicine programs or plans. Even if you're, let's say, a chiropractor who does maybe basic functional medicine, nutritional stuff, still having some kind of club or thing patients can join, not to be like a way to take their money, but it's a way to keep them engaged. You are the leader, you're the health expert, keep them engaged, bundle your services in a way that gets them excited to keep coming back. So hope that helps. Comment below if you need help, more clarifications. I think somewhere you can also comment below the words clarity quiz, which we'll go ahead and send you my free quiz. It takes about 3 minutes. Kind of tells you where you're at, your functional medicine journey. Are you starting to build out? Are you kind of stuck? Are you reliant too much on manual work versus systems? Are you pricing things correctly? The important things when it comes to business. You're a smart clinician. You have a lot of knowledge that your patients need. Now let's set the systems in place to allow you to be successful. So thanks for watching, and we'll stay tuned next time.